We were kind of back and forth with Anthem trying to get the best renewal rate that we possibly could. So took a little bit longer this year. We have a strategy for next year to make sure that we'll be on course and on time like we normally are, looking around early October for open enrollment to begin. So we just want to apologize for things being a little cramped this year. But we still have a lot of time left, and I believe we have a good time frame for you all to get things done and get your renewals done. So we have John Leggett from MSI who's going to talk with us about some of the changes that have occurred. And we'll also have a schedule for employees to come and meet with MSI individually. Even though the majority of our employees are going online and they're enrolling in their benefits online, we're encouraging them to go online as well because it's very user-friendly. If you're not afraid of a computer, it's very user-friendly, and their information is all there, and it doesn't take long at all, especially if you're not making changes. You're just going back on to verify. So, John, turn it over to you.
Thank you, Frederick. Good morning, everybody. It's John Leggett with MSI Benefits Group. Glad to be here. I think this is our 5th or 6th year here, and you may have grabbed your packet from the back, but you'll see the boxes, and hopefully we can distribute those today when you leave. I have a couple of carts I can help you take some out as well, some of those big boxes. But I'm going to go through this PowerPoint, and I encourage you to ask questions. You're more than happy to answer them as we go along. You can just raise your hand, and I'll help you out. So I'm going to get started. And I was thinking about this. Rather than starting in order of this PowerPoint, I'm going to go here. Okay, I'm going to go back. But the reason I'm starting here is because the good news is this year we're renewing the medical plans, and the deductions that employees pay are not changing. And you can see those deductions have been in place for, I think, 3 years now. Since 2017, they've not changed. So the two plans that are offered to all employees through the county, which the county pays the majority of the cost, but the deductions that employees pay are not changing. So I'm going to come back to that, but I just want to start off with what's not changing. Now, if I come back to slide 2, this is highlighted in the packet. You, of course, get a new employee benefit handbook. Everybody's going to get one of these. And there's a letter kind of summarizing what's going on. A lot of everything that's in this PowerPoint is in this letter. So employees that get this packet and read the letter, they'll have a real good understanding of what's going on. And then, of course, we're going to be here for open enrollment individual meetings, and we'll talk a little bit about that. But as far as the changes that are taking place to the medical plan, you may recall last year nothing changed. The deductions held and the plan design. And when I say plan design, I mean deductibles, co-pays, all of that remained the same last year. There were no changes. This year, we saw an increase in claims, and in order to try to get the cost down on what was expected for 2020, we had to make some changes to the plans. One of the things we see here, and not just here, but really everywhere, is folks using the ER for non-emergency usage. And so it's pretty common nowadays when you see health plans having a copay of $300, $400, $500 when you go into the ER. And so that non-ER usage is still up. So one of the changes that's taking place this year is the emergency room copay will now be $300. The primary care copay, your family medicine, family doctor, internal medicine, that type of doctor, is going to go to $30 on each plan. So both the HMO and the point of service. Specialist copay will be increasing to $60. The medical deductible will be $1,000, and that's per individual, and it's capped at 3 times for the family. So the deductible, which starts over January 1st, will be at $1,000, and for the calendar year per individual at a maximum of 3 if you have family. So if you had 5 folks in your family, only 3 would have to meet that deductible, and it would be capped. The out-of-pocket, this is the portion that you pay once you meet the deductible. Actually, this does include the deductible. I'm sorry, jumped ahead. The maximum, the maximum out of pocket is $3,000. It is going to $3,000. This is the amount you meet once you meet the deductible and your coinsurance. So the $3,000 does include your deductible. And then once you meet the deductible, you have to pay 20%. And when your 20% portion equals an additional $2,000, then it's capped. So that is the maximum out of pocket for the year. As far as, everyone's familiar with the Affordable Care Act, ACA, you've heard about. ACA sets where the maximum a health plan can be at, and I believe for 2020, it's right around $8,000 that the ACA says, okay, it cannot be in excess of that. So we're still well below where that maximum ACA out-of-pocket maximum is, but it did go up. It will be going up effective January 1 to $3,000. The other thing, there's some other changes. Anyone that's experiencing and going through chemo and radiation in a physician's office, it will now be subject to the deductible and coinsurance under the POS plan. So that's currently in place on the HMO. So that change was made under the POS, so it will match what's in place under the HMO. The telemedicine, anybody in here use the Teladoc where you download the app? Okay, great. You had to pay $10 for that this year. There'll be no cost for that next year. So starting in 2020, you and any covered members will be able to use the Teladoc, I'll call it Teladoc, Live Health Online, and see a doctor at no cost. And so if you haven't used it, I've used it a couple of times, used it for myself and my child, but you can go on there, you pick a doctor, you tell them what's going on. If they can diagnose and they figure out, all right, you've got a sinus infection, they can send your antibiotic down to your pharmacy. You go straight from your home or work, you pick it up, and you never step foot in the doctor's office, and it didn't cost you anything other than what you had to pay at the pharmacy. So it's a really neat feature, and we've actually, Blue Cross and the county agreed to just waive the cost in that, so no cost. Now, when you go on there, it's still, because the system, the way it works, it still may ask you to put a credit card in. I know that's kind of funny, but there's literally no cost. So, but that will take effect January 1. The other thing is surgery at a freestanding facility is no longer subject to your deductible. And when we put this together, I wanted to put outpatient surgery there, but it could be confusing because if you have, the hospital has a freestanding facility, that is actually part of the hospital. And that may not be subject to that waiving of the deductible. So it's, when you go to the hospital, you step foot in the hospital and you have anything done there, typically it's gonna be a lot more expensive than it would be if you go to a standalone facility. Say you're gonna wanna have an MRI or something like that, then it's going to be much more cheaper to go away from the hospital. And so to incentivize members to look into that, it's not subject to your deductible when you go and have surgery done at a freestanding facility. So those are the only changes made to your plans, the two plans on the medical. As far as the pharmacy, there's some changes here. Blue Cross rolled this type of pharmacy program out about 2 years ago. And the county's implementing it this year, and that is where we have two sets of pharmacies. We got level 1 and we got level 2. If you go to a level 1 pharmacy, your copays will remain the same. There'll be no change. So it says tier 1, that's going to be like a generic drug. Tier 2 might be the preferred name brand. Tier 3 is the more expensive non-preferred, and then Tier 4 might be your specialty drugs. And those copays are currently in place now, 15, 30, 60, or 20% up to a $200 maximum if you go to level 1 pharmacies. And you can see a level 1 pharmacy is going to be CVS, Kroger, Walmart. Some local ones is Lithia Springs Pharmacy and Sam's Club. There are more. We put those on there. As far as the level 2 pharmacy, you can go down the bottom and see what a level 2 pharmacy is. There's more local ones there. D&B, Douglas, Discount Pharmacy, Premier Drugstore, Apothecary Shop, Williams Pharmacy, and Wyatt's. Those are all considered level 2. I don't know why Publix isn't on there, but I believe Publix is a level 2 pharmacy as well. So if you go to a level 2 pharmacy, you can see what your copay will be per tier. It's $10 higher. And the reason this is because the arrangement that Anthem's pharmacy piece has with these pharmacies, they pay more. They don't have the same arrangement with those the level 2 pharmacies as they do with level 1. So they created a plan that says, okay, if we have to pay more, then we're just going to pass part of that cost on to members. Obviously, you have the ability to change pharmacies. If you're using Publix, you can go to Kroger, and that would be considered a level 1 pharmacy, and your copays wouldn't change. And so these were rolled out a few years ago, and this will go into effect January 1st. The benefits, I don't know if you can see that, but this actual side-by-side, yes, question? We're still doing the mail-in. Yes, the mail-in is still the same as it is today, and it's still the 2 times what you pay now, and you're using the same mail-in provider, correct? if you do the maintenance drugs. This is in the handbook, but this is a side-by-side. A lot of the changes that we are included on here. The deductible, as I said, is $1,000 under each plan. The coinsurance actually is I think I said 80. It's 90% on the HMO and it's 80% on the POS. The out-of-pocket, again, is the same under each plan, $3,000 or $9,000 for the family. $30 and $60 copays, $30 for primary care, $60 for specialists. Preventive, of course, there's no cost. You go in for your annual physical, no cost for that. The Live Health Online, that cost for that is going away as of January 1. And urgent care did not change, it's $60. And then you can see the ER copay, again, is going up to $300. The HMO, of course, requires you to name a primary care physician and obtain referrals to see a specialist. The POS does not. It's an open access plan. The HMO does not have out-of-network coverage, whereas the POS does. The drug card below, you can see there's the mail order. Now, the mail order, again, it's 2 times for each tier that you're, so 30, 60, 120, and under each plan there. Again, no change in deductions. That's the most important thing, in my opinion, is that the cost that you're paying is remaining the same. Everybody will receive a new ID card, but you can see the biweekly cost that comes out pre-tax. The county will continue the tobacco surcharge. Any employee or using tobacco in the previous 90 days will be required to pay that surcharge. If you've stopped using tobacco, you can change your answer, and that surcharge will go away. And of course, the county has the working spouse rule that was implemented years ago, in that if your spouse is covered under the county's plan, has coverage available through his or her place of employment, then there is a surcharge, again, of $25 there per pay period, and that will remain in effect. Yes?
Regardless of if they take the coverage or not?
It is, yes. Live Health Online, I mentioned this, but if you haven't done this, we recommend to go ahead and download the app and register. And again, right now it's a $10 copay, and it will go to no cost at the start of the year. It's a very nice feature, and you can download the app either through App Store or the Google Play and go ahead and register. And again, basically you log on there. It'll tell you how many doctors are available, what the average wait is, how many people are in front of you. You click on it, you wait. Generally, it's less than 5 minutes, and then the next thing you know, you're talking to a doctor. I think they're just sitting at their house in a desk and seeing patients on their phone, or on their computer, so it's kind of cool. And there's more information that's on the handbook. Psychologists and therapists are available through this as well, and that is a $30 copay if you go that route. Yes, ma'am.
You keep saying there's no change in the individual deductible, but if I'm correct, it was $750.
The deductible is $1,000. It was $750. That did go up. There's no change in deductions. Yeah, sorry. That's correct. Another change for the positive is the health and wellness incentives. I'm sure folks here are familiar with it, whereas you had to get the form, you had to fill it out, you had to fax it in, and then you could earn rewards, and they would send you something, but you would get a credit once you used the card. It was kind of confusing, to be honest. And we finally just said, look, we want to change this, make it a little easier for employees to benefit from it. So starting January 1, it's this simple. If you get a physical, a flu shot, mammogram, or colorectal screening, you're going to be receiving $100 for a physical on a gift card, $50 for a mammogram, $25 for the flu shot, and $50 for the colorectal screening in the form of a gift card that will be mailed to your house. I believe it's a MasterCard, and it's reloadable. So let's say you go and you get your flu shot to start with. You get $25, they're going to send you that, and then you get your physical. They will automatically load that $100 on the card. So don't throw it away. It is MasterCard. It can be used anywhere. You don't have to do anything. You don't have to fill out a form. There's no form that you have to fill out. It's just automatic. And so you can earn up to, I believe it's $225 on the card this next year. So that's a new thing, and it should be a lot easier. So any questions out here? Nope? Okay.
I'm sorry.
Yeah.
I know with the flu shot, currently, it has to be a Blue Cross Blue Shield sponsored flu clinic in order for that.
That's a good point. It has to be claim driven.
Okay, so you have to file the.
Right. It has to be submitted. There's no cost for a flu shot. So you would have to give them your card. They have to submit it. There's a little code that they submit to Anthem. Anthem sees, all right, you got your flu shot, and they automatically generate the
So it has to be the Blue Cross Blue Shield, like, can you go to Kroger and get your shot?
If Kroger will submit the claim to Blue Cross, then yes. If they're considered an in-network provider and Kroger can file with Blue Cross, then you would earn that reward.
Okay, so
Yeah.
but if they're not
Then
considered.
you wouldn't earn it. Yeah. So it has to be seen on the back end by them in order to keep.
Couldn't file a claim after the fact.
I don't believe it's set up that way, no. Any other questions? Last year, we were talking about the new Engage app. Well, Blue Cross went and changed that, and now they have an app called the Sydney app. Anthem Sydney app that they're wanting everyone to utilize. I don't know if any of you utilized and downloaded the Sydney app, but now the new app, effective January 1, they're calling it Sydney, gave it a name. But you can also download this on your phone, and this is pretty neat. You can see claims, you can view ID cards, you can look for providers, there's a lot you can do on there, right at your fingertips. And so go ahead, I think you can go ahead and download the app, but if you can't, it'll definitely be available January 1, but I think it's out there. I just don't think it will be functioning until January 1st, 2020 of next year. And there's more information. Everybody's going to see this in the handbook too. There's a page that looks very similar to this. As far as other benefits, there really are no changes. So the dental, you're still going to have the two plans. The deductions didn't change. You got the base and the buy-up plans. That's going to continue with Anthem. The vision, again, still going to be with Anthem. Now, again, if you have the medical, you're going to receive a new ID card because of the changes to the pharmacy and deductible and out-of-pocket. So that one card you get is, of course, your dental and your vision card. So you will get a new card for these. Even though nothing changed there, you will get a new card, hopefully sometime in December. But the vision and dental will remain the same. No change in benefit or cost. The county provides every single full-time employee with life insurance in the amount of 1 times annual salary. Employees also can purchase additional life. Many of you have it. If you don't have it, now is the time to try to enroll in this during open enrollment. You'll fill out a health questionnaire, and the employees will answer medical questions to be approved. We can help you during the individual enrollments. You can do this online. If you go online and you try to add extra life, you'll see the form. You just print it. You can take it to HR, or you can send it directly to MSI, which the information is online and in the handbook, of course. Did you have a question? Okay. And that is going to remain with Dearborn National. We also have the county offers short-term disability and through One America, and they pay for, the county gives every single full-time employee long-term disability coverage. The short-term fills that gap. It's voluntary. You pay for that. Now, the good thing about the short-term, this changed maybe last year. It's one of those, if you want it, you can get it. There's no medical questions. You have to sign up for the coverage during open enrollment. And so it's guaranteed issue during open enrollment. There is a pre-existing clause of 12 months for anybody that signs up for it new. That just means if you had knee surgery 2 months ago and you buy this coverage, and in February you got to have something, correction on your knee, and you're going to be out, that would be considered pre-ex. They wouldn't cover that. But after 12 months, everything's covered. And that is, again, only for new employees. And so short-term is guaranteed during open enrollment. Just remember the pre-ex. The supplemental coverage did not change. Everybody is familiar with AFLAC, and we have the accident and the critical illness that's still offered as a voluntary benefit to employees. And then there is the flexible spending account. Hopefully employees take advantage of this. Part of it is the FSA, which is the flex spending, and the dependent care account. The IRS, for 2019, the IRS always does this. They increase the amount employees are allowed to contribute, and we literally got the alert last night that it went up $50 for 2020. But for 2019, it was $2,700, but last year we told you $2,650 because they did it so late. So it's always $50 behind, but the maximum for 2020 through the county would be $2,700. And so it'll be $962 for the minimum. If you wanted to participate, it's $250. And this, just to refresh your memory, the way I describe the flex is it's like a tax-free loan given you by the county that you pay back over the course of the year out of your paycheck. So if you do the minimum of $250, you get a card, I believe it's a Visa card, loaded with that $250. On day one, January 1st, you're able to use every bit of it, and then you pay $962 every paycheck, and you're paying it back pre-tax. So if you're doing $250, that might be $220 out of your take-home pay. So the idea is you're saving about $30 in taxes. You can use it for medical, dental, and vision, You can use it on your spouse and kids, even if they're not covered under the county's plan. So take advantage of that. I think we'll say this in a minute, but the county wants everybody to reconfirm, either come in and see us or go online. And the one benefit that can absolutely not be carried over without you acknowledging it is the FSA. So if you have the FSA, you absolutely have to log in. And I'm saying that, we want everybody to log in, but there's always a handful of people that don't. And so we want to try to get everybody to confirm for that reason. New benefit this year, and I think this may have been put out here a month or so ago, or a few months ago, is the Legal Shield. And there's information in the handbook, Legal Shield, ID Shield. You can see what it says, and this is literally taken from the handbook. So basically, the Legal Shield, everybody may be familiar with legal coverage, and not everybody's going to need legal care, legal help, hopefully. But the one benefit that I like about this is you get right off the bat is will preparation. They'll do a will for you. They'll help you complete your will. Most people don't have a will, and so even if you sign up for this and you never need legal assistance, you can at the very least get a will. And so this is being offered through the system this year. The ID theft is basically exactly what ID theft protection is basically. You know, you keep hearing about security breaches and everyone. JCPenney and Target and Equifax, and that's just off the top of my head, Macy's, I don't even know. There's so many places that are getting hacked that this is very important. It protects you. They help you recover any issues. So if someone comes in and affects your credit, they'll help you get your credit back to where it was. As far as the legal, they'll write letters on your behalf. They'll represent you in court for certain things at a discount. IRS audit assistance, trial defense. But so these are very inexpensive. You can see the cost. These are monthly. I should be on there. It says it in the handbook. Doesn't say it clearly here, but these are monthly costs. The family price for the Legal Shield is $15.95 a month. Family price for the ID Shield is $15.95 for family. If you want both, it's combined $28.90. For individual, it's $15.95. Or $845 for a total of $2340 if you want both. So you can see those costs. That'll be offered through the system. That's never been offered before through our platform, so you'll see that. And again, there's more information in the handbook. Our online, this is kind of a good lead-in talking about the ID theft. Last year and every year you've enrolled, it's been pretty simple to go into eLect. You type in the code, you type in your social, and you log in. Well, it's a little bit different process this year. And again, it's to protect the ID or the identity and the information of all the employees and the members in our system. And so they added extra layers of security. What's going to happen now is you're going to go to the same website. You're going to put the new code in for 2020, which is the 199. And then it's going to say you need to set up an account. So you put in your username. You put in your ID, which is still your social. You put in with no dashes, you'll put in your PIN. My birthday is July 2nd. My PIN is, your PIN is your month and day, so mine will be 0702. You put that in, and then you set up a username and password, which you'll use every year from here on after. You'll set up the username and password. There's the rules. Any of you ever gone to online banking or anything like that, you've had to go through this process. But you'll set that up. You'll set up 3 security questions, and we have no control over the questions that they ask, like who was your childhood hero, that kind of stuff, like who remembers. So there's some crazy questions on there, but answer the 3 questions, and then you got to verify it through a text, a phone call, or an email. There'll be a code. You plug that in, and then you can enroll. So it's a little different than how it's been in the past. If you wanted to bypass all that, that is the benefit of coming in and seeing one of the MSI representatives. So there is that we go in through the other side, and we don't have to worry about that. So if employees don't want to go through that process and hassle, if you try and you're like, you know what, you can call our office, we can try to walk you through it, or you can come in and see us. Yes, ma'am.
I have a question. My book has 3 zeros and that has 2 zeros on the enrollment ID. Which one is correct?
3 zeros. I made a mistake on this. So. Yeah, thank you. You guys are the only ones seeing this PowerPoint, or anybody, I guess, that watches it online. Please note that the book is correct. I made a typo looking at that. It's 3 zeros, so it's 1,099, not 100. 100099 will get you in there. My apologies on that. Sorry. We are asking everybody again to confirm the benefits. The deadline this year, as Frederick was saying, is pushed back a little bit, but the deadline's going to be Friday, December 6th, where employees can go online or come in and see us. This is the open enrollment dates. It's in the letter, but we will be here on Monday, November 18th, at the courthouse, down in HR from 8 to 12. Tuesday, we'll be at the sheriff's from 7 to 12, and we're going to go over to the fire department that day from 1 to 3. And then Wednesday, we're going to be back over here from 8 to 12. Every year that MSI and every year we've done this, the amount of people that we see goes down. So more and more people are going online. There are some changes this year, some new benefits, and of course the enrollment process changed a little bit, so maybe we'll see a few more. But these are the dates, and again, employees are more than welcome to call us. We have our information on the back of the book here, and we encourage employees to call us if they have any questions. And other than that, that is the end of the presentation. Many of you grabbed your packets. We have them sorted by department in the back. If anybody's taking fire, I just want to point out that that box broke on the back, so be careful with that one. That is the last day. Correct. So the last day to enroll is 5 p.m. on Friday, December 6th. Questions? Yes.
Does that Sydney app replace the Anthem Anywhere app?
It does. They want to use that for everything. Too many apps.
And then there's a separate app if you have the FSA.
Yes. That is
What's the app, the FSA? I didn't realize.
that. It's probably you threw me for a loop there. Yeah, it's Health Equity.
Yes.
Okay, it's the Health Equity where you can scan the receipts and all that. Yeah. Any other questions?
And again, thank you all. If you all would, please disseminate those packets as soon as possible. Make sure that your employees and your staff members receive those packets, preferably today or before the end of the week, no later than early next week. So I'll be sending out an email just to let everybody know that open enrollment is underway. And I think if there are no further questions, I think that will be it. Thank you all for coming.